Hi, and welcome to the HASA ProviderAssist Community Portal training. This training video will give you a basic overview of how to use HASA ProviderAssist. Once you've logged in, you will search for a patient. There are a number of ways to search for patient records from the ProviderAssist homepage. You can search in this box or this box, and you can do a simple search by the items listed here: medical record number, name, first, last, or last, first, social security number, date of birth, 2-digit month, 2-digit day, 4-digit year, with backslashes. It does search partial words, so if you can't read all of the letters or numbers, or are unsure how to spell something, you can type in part of the name or part of the social, and it will return results that match that partial. It also searches for commonly associated aliases and nicknames. A search for Robert will bring back Rob or Bob. A search for James will bring back Jim, and so on. If you're searching for a patient with a common name, and there are too many results to look through, try searching by birthday instead, and then you can find the name a little bit easier in that list. If you'd like to do a more advanced search by one of these options, you can also add part of their address. Sometimes when searching, you'll get a message that says no patient records to display. Based on your organization and login type, if you're not in an emergency room, you will only see the records from patients that you've seen at your location. If you have never seen this patient before, you'll need to break glass. To do so, you'll click on the break glass icon in the top right corner. Once you click that, you should be able to see all of the patients that meet the search criteria you've entered. Breaking glass is an auditable action, which means that we can track it on HASA's side. If you've had to break glass to see a patient's information, a hammer icon will show up over here on the left. You also might see a plus or minus sign on the left of the patient's name. This is how all matching records are grouped. So if you have a plus sign, click on it, and you can see that that patient has multiple records in our system that have been matched together by a patient matching algorithm. Once you've identified the patient you're looking for, click on their name. If you've had to break glass to see this patient, you'll get a prompt to give a reason for breaking glass. There will be a drop-down with some different options for you to select. You will have one-time access to this patient's information and will need to do this every time you search this patient. Once you've opened the patient's record, this is what you'll see. Before we get into the different tabs, I'd like to point out this feature. Next to the patient's name and information, there's a little icon that looks like an index card. Hovering over this will give you a snapshot of the patient's information, including allergies, guarantors, address, and so on. This is available anywhere in the record, so you can find this information quickly, then drill down into the tabs for more information. The tabs across the top are different ways to organize much of the same information. You will select the tab based on what you're looking for specifically and how you'd like to see it. You'll be defaulted to the Encounters tab each time. If you'd like to see information based on encounters the patient has had, you'll select the Encounters tab. If this is a brand new patient and you'd like to get an overall picture of where they've been across the community in the last couple years, you might spend some time scrolling through these encounters. On the left side, you can toggle the date range, the type of encounter, the patient class, or the provider to be more specific for what you're looking for. The date range for every tab is defaulted to the last 3 months, but you can select this and choose all if you'd like. Below this, the relevant encounters are listed by dates, similar to a table of contents. Next to each of the encounter dates, you'll see how many documents are associated with that single encounter. If you'd like to see all information associated with that encounter, you can click that date. If you'd like to see what kinds of documents are included with that encounter, you can click the plus sign to expand. One feature of the Encounters tab is that in the top right-hand corner, you can see there are two View All buttons. Here you can see the care team associated with that encounter and the problems list associated with that encounter. You may print information from this tab by selecting the Print button on the top right. You will get your print preview window, and you can decide whether to print or save this. There will be a date and time stamp at the bottom, and it will indicate who printed this for security purposes. If you save anything to your computer, make sure that you save it behind the firewall because it is PHI and you are liable for it. Next, we'll go to the Tests tab. If you're looking for a patient's results for specific tests or looking to see what tests a patient has had, you'll search on this tab. On the left, you can narrow down by type, date range, or provider. You will see all tests listed in the table of contents style below the search options, and you can decide whether you'd like to see them grouped by date or by test type. To see the results for a specific test, you can expand that section and select the date. Lab results will be listed in this fashion, and it will indicate whether that result is out of range. You can see the reference range based on the performing lab's reference ranges and the actual result. You can hover over the blue circles with the eye for more information on ordering provider, encounter location, and testing location. You may print or save this information using the Print button at the top right. If you'd like to see demographic information regarding a patient, you should use the Patient Info tab. This tab does not include any clinical information, so if you have someone in your office that would benefit from access to patients' demographic data, but no need to look at clinical information, you could create a user with access to just this Patient Info tab. In this drop-down, you will see patients' different profiles at each of the locations they have been seen. The drop-down will show you the different locations and MRN at each of those. So if you need to contact another hospital for information regarding this patient, you can help narrow down the patient by giving them the MRN number for their hospital. The information on the page below will change based on which location you've selected in this drop-down. This tab is useful if your organization is missing demographic information on a patient because you can see what they've shared with other locations. You can also print or save this information using the Print button at the top right. The next tab is the Face Sheets tab. The Face Sheets tab will give you a quick clinical snapshot of the patient. This top section is a list of all encounters this patient has had, listed from most recent to least recent. They will be listed 5 at a time. In this top corner, you can see how many pages of information there are for this patient. Below this is information specific to the encounter that you have selected in the top section. You can expand or collapse any of these sections below using the plus or minus signs on the left. Or at the top, you can collapse all sections or expand all sections. With this page, you can print or save information using the print button on the top right. If you're looking for any reports available for this patient across the community, such as transcribed documents, discharge summaries, or history and physicals, you'll use the Reports tab. You can choose a specific type of report to view, the date range, and the ordering provider to help you narrow it down. Here, like with the Tests tab, you can have them listed by date or by type. If reports are available, they will be listed here in the table of contents format. And you can print or save reports using the print button. If you would like to view any CCDs or community treatment plans available, or save or print all or a portion of the patient's record, you'll use the Documents tab. Documents will be listed in this section by date in the table of contents format. To view a document, you'll select it by clicking on the title, and it will show up similar to a PDF. If you would like to combine elements of different encounters to create a consolidated document that is easy to read, you can select the New CCD button in the top right-hand corner. This will allow you to select bits and pieces of different encounters to combine together for your records. In this bottom section, you can select the different reports, tests, or documents that you'd like to keep. In the top section, you can select what kind of information you'd like to include by selecting or deselecting these boxes. Once you're done selecting everything, click Preview. You will see everything you selected in a summarization of episode note, like this. Because you are allowed to pick only sections of an encounter, there is a disclaimer that says this is not a complete medical record. You have the option to publish and save, or save only. We suggest that you always click Save Only, because anything you publish will become part of the patient's record permanently, and your name will be attached to this created document. When you select Save Only and Submit, you will be prompted to provide a purpose. This is an auditable and trackable action. For HASA's use. Once you're done, it will be saved to your computer. Reminder, if you save anything to your computer, make sure it's saved behind the firewall because it is PHI and you're liable for it. That is an overview of the ProviderAssist Community Portal. Thank you for watching this training video.